What qualities make a good ICU nurse? I believe strong clinical skills and the ability to stay calm under pressure are essential. Good. And how about teamwork? Teamwork is crucial. We have to communicate clearly and support each other. Excellent. What would you monitor in a patient with septic shock? I would closely monitor their vital signs, including blood pressure, heart rate, respiratory rate, and temperature. I'd also check their urine output, lactate levels, and white blood cell count. That's a solid answer. And what interventions would you initiate? Administer oxygen and IV fluids and start broad-spectrum antibiotics. What are the signs of increased intracranial pressure? The signs include a severe headache, vomiting, and changes in mental status like confusion. You might also see blurred vision, and in severe cases, Cushing's triad, hypertension, bradycardia, and irregular breathing. Excellent. That's a very complete answer. Describe a medication error or mistake. A patient was given a higher dose of medication. I immediately checked their vitals, notified the doctor, and documented the error. Afterward, I reviewed the process with my team to prevent future errors. Thank you. That's a very thorough answer. How do you support relatives in ICU? I prioritize clear, empathetic communication, updating them regularly and listening to their concerns. I also guide them through the ICU environment and connect them with the support resources. That's a solid approach. Thank you. Describe your experience working in a multidisciplinary team. Certainly, in my previous role, I collaborated with doctors, physical therapists, and social workers to create integrated care plans for patients. For example, on a complex case, we held daily rounds to align our strategies, which improved the patient's mobility and discharge time. Excellent. Thank you. What would you do if a ventilated patient became agitated? First, I would check the ventilator settings and vitals for any issues. Then I would assess for pain or discomfort. Good. And if that doesn't resolve it, I would consult with the doctor and consider a low-dose sedative to keep the patient calm and safe. Excellent approach. How do you prioritize patients? I use the ABCDE method: airway, breathing, circulation, disability, and exposure. This helps identify life-threatening issues first. Excellent. That's the correct approach. Thank you. Tell us about a time you dealt with an emergency. Certainly. During a night shift, a patient suddenly went into cardiac arrest. I immediately began chest compressions while calling for help. What was the outcome? We restored a pulse. It was a great team effort. Excellent. Describe your experience working in a multidisciplinary team. Certainly. In my previous role, I collaborated with doctors, physical therapists, and social workers to create integrated care plans for patients. For example, on a complex case, we held daily rounds to align our strategies, which improved the patient's mobility and discharge time. Excellent. Thank you. What is sepsis, and how would you manage it? Sepsis is a life-threatening condition caused by the body's extreme response to infection. For management, I would follow the sepsis bundle, immediately administer broad-spectrum antibiotics and IV fluids, monitor lactate levels, and ensure vital signs are stabilized.
Good. And what about vasopressors?
Yes, if hypotension persists.
What would you do if your patient's oxygen saturation suddenly drops?
I would first assess their airway and breathing, then apply oxygen and check their vitals.
Good. And if that doesn't improve it?
Then I'd call the doctor and prepare for possible intubation.
Excellent. That's the right approach. Your patient with a GI bleed collapses. What steps would you take?
First, I would call for help, then assess the airway, breathing, and circulation. I would place the patient in the Trendelenburg position, start oxygen, and get an IV line.
Good. And for the GI bleed, I'd insert an NG tube and prepare to administer blood product.
Why did you apply for this role? I've always wanted to work in a hospital where I can make a real difference in patient care. I admire the values of this institution.
That's a great answer. How do you handle a peer who is not pulling their weight?
I would start with a private conversation to understand any challenges they're facing. Then I would offer support and remind them of our team goals. If it continues, I'd escalate to a supervisor.
That's a solid approach.
So, tell me about communication in nursing.
It's the foundation of patient care. We listen, clarify, and empathize.
Exactly. Why is listening so important?
It builds trust and helps us understand their needs.
Perfect. And clarifying?
Prevents misunderstanding.
Tell me about a time you advocated for a patient.
A patient was hesitant about a procedure, so I listened to their concerns and explained the benefits clearly. I advocated for them by requesting a specialist consult, which helped them feel more comfortable.
That's a great example. You really listened and put the patient first.
Thank you.
Tell me about patient education and how you go about it.
Certainly. I start by assessing the patient's learning needs and health literacy level. Then I develop a personalized plan using clear language and teach-back methods. Finally, I evaluate their understanding and provide follow-up resources.
Excellent. Thank you.
You were collecting a blood sample from your patient, and then he collapses. What would you do?
First, I'd ensure my own safety, then immediately call for help. I'd lower the patient's head and elevate their legs, monitor their vitals, and be ready to start CPR if needed.
Good. And after stabilizing the patient?
I would document the incident and report it to the doctor.